Hi again, everyone. This is Jim Henry, and this is Tinnitus 101, the basics for everyone. We've covered 3 parts. This is part 4 of 5, treating effects of tinnitus. And the last one will be part 5, keys to benefiting from treatment. So, treating effects of tinnitus, this could be days and days of covering all of the different methods of treatment. We're going to cover everything in about 20 minutes. So all I can do is give you a brief overview of the different methods. I focus on the ones that are most established, research-based, but I also list at the end the many options for treatment. Some of them are experimental, some of them have no proof whatsoever, some of them are well established. So we're just going to give a brief overview, and then we'll do keys to benefiting from treatment, which is a very short presentation. And that will finish up this series of 5 sessions. So we've mentioned often there's no cure for tinnitus. That means there's no cure for the sensation, the sound of tinnitus. But there are different treatment methods available to treat the effects of tinnitus, to reduce the effects of treatment. So that's what treatment focuses on. And any claim that any method can reduce the sound of tinnitus, take that with a grain of salt, because there is no proof that we can do that consistently and safely. And the goal is for tinnitus to have little or no impact on daily life, even though the sensation is still there. And that's what habituation is all about. You want to get to the point where you're not thinking about your tinnitus most of the time, and when you do think about it, it doesn't cause any particular reactions. And that requires accepting your tinnitus. And there's a couple of different philosophies on accepting tinnitus. One is to face it head on from the get-go and learn to accept it. And eventually you have to accept it to habituate to it. But another philosophy is to distract yourself from it while you're learning techniques to self-manage your tinnitus. And then eventually you get to the point where you can accept it, and that will allow you to habituate to it. So acceptance and habituation go hand in hand. And at the end of this presentation, I've got 2 slides that list different treatments for tinnitus, and there are a lot of different approaches to treat tinnitus. And what we can really say is that anything that makes you feel better can be considered a treatment for tinnitus. That's why so many people take supplements, and they stop drinking coffee, or any number of things that they can do to make them feel better, and then that's considered a treatment for tinnitus. Also, the placebo effect is something to be very aware of, and the placebo effect is obvious with medications and drugs, where you can take a pill, and maybe the pill has nothing in it that's active, no active ingredients, and yet a person feels better. The placebo effect is a very strong effect, and it's well known to kick in with all kinds of health conditions. And in fact, practitioners take advantage of the placebo effect. And there's nothing wrong with that. If a person feels better, they feel better. We don't want to be deceptive, but frankly, with tinnitus treatments, the placebo effect could be why people feel better. That deserves a whole presentation of itself, but just keep that in mind, that it may be the placebo effect that's the reason that a method is helping somebody. And also, there's no evidence that any one method of treatment is any more effective than any other method. Now, I will say it's generally acknowledged that cognitive behavioral therapy has more evidence in the literature than any other method. But that does not mean that CBT has been proven more effective than any other method. There's just more literature support, more scientific support. We know that CBT is helpful for most people who receive CBT specifically to treat their tinnitus by a competent CBT provider. And what I'm going to do is just give an overview of different methods that are well established in the literature and by research. And I can't cover everything, and I can't cover anything in detail. This is just an overview, and more information is available if you want it. Sound therapy is controversial, but from my perspective and from most audiologists' perspective, this is a go-to method of treatment for most people with tinnitus. In fact, I use sound therapy pretty much every day. It helps me to sleep at night. Now, I can sleep without sound therapy, but it just takes the edge off. I'm not lying there listening to my tinnitus. I'm listening to an audiobook or I'm listening to a podcast literally all night long. I have sound in my ears, and it's generally somebody talking, and it's not the type of talk that would get me riled up. It's just talk. It can be any number of things, and that's my sound therapy while I'm sleeping. Different people use different types of sound. When I'm sitting at my computer, I like to listen to Baroque music. That's my background sound. I could call that soothing sound. And notice at the bottom of the slide here, we have different goals for using sound. One is to provide a sense of relief, to just feel better as a result of hearing the sound. That's the Jack Vernon method, the masking method. It's not trying to cover up the tinnitus, it's trying to make the person feel better, to induce a sense of relief. There's distraction, distracting the mind from thinking about the tinnitus. So when I'm lying in bed listening to a podcast, I'm distracting my mind from paying attention to the tinnitus. And that can be very effective for people. And then just sound in general, we call that background sound, can help to promote habituation. We talked about the candle in the dark room and how that is similar to tinnitus in quiet. You turn on the lights, the candle is less noticeable. You turn on some sound, the tinnitus is less noticeable. And it's commonly believed, we can't prove it, but having background sound all day, all night, helps to promote habituation, and you want habituation. So sound can accomplish all three of these objectives, and it's, like I said, it's a go-to method of tinnitus treatment. Hearing aids can accomplish sound therapy just by raising the level of the sound, the background sound. And also you can stream from your smartphone to your hearing aids. Sometimes hearing aids have sound generators built in. Hearing aids are a sound therapy device. So this is what I just talked about in the last slide. There's soothing sound, there's interesting sound, and there's background sound. And if you're interested at all in using sound as therapy for your tinnitus, it's important to be aware of these three goals and how to accomplish them. And again, that's something I wish I had more time to talk about. I don't in this presentation, but just remember, you can use sound to have a soothing effect, to have a sense of relief. That's the Jack Vernon method. You can have interesting sound to distract the mind away from the tinnitus, and that's often used to treat pain. There are methods of distraction for pain relief. And then constant background sound promotes habituation. This is, I would call this the Pavel Jastreboff. Dr. Jastreboff is probably best known for promoting habituation by using sound therapy, and TRT has a very specific method of sound therapy. Cognitive behavioral therapy, CBT, this is always at the top of the list. If you're talking about methods of tinnitus treatment that have an evidence basis, you've got to go to CBT because it has a strong evidence basis. When I say strong, I mean relatively strong, because it doesn't help everybody, and there's very few practitioners who are competent in providing CBT for tinnitus. So if you want to go to a psychologist or another behavioral health provider to receive CBT for tinnitus, you're probably going to have trouble finding anybody. So you can go on, not online, but you can go virtually, and there's psychologists available by Zoom or other methods of video conferencing or telephone. And so you can receive CBT for tinnitus, but it might require going outside of your area and doing it via telehealth. And there's different components to CBT, many different components. What's usually used for treating tinnitus is relaxation techniques, which would be deep breathing and imagery, distraction techniques, that's part of traditional CBT, staying busy with enjoyable activities, and cognitive restructuring means thinking differently about your tinnitus. That can be a hard thing to accomplish, but it can also be very effective. Thinking more constructively, reframing your thoughts about tinnitus. And that's what this diagram shows up here, is that your thoughts affect your feelings. So if you think more positively about your tinnitus, you can reduce your anxiety about tinnitus. That's the basic concept. So this is this loop of thoughts, feelings, behavior, and it can be a vicious loop if your thoughts are negative and cause negative feelings. And third wave CBT, so I talked about facing your tinnitus head on. Third wave CBT uses the methods of mindfulness and ACT. ACT is acceptance and commitment therapy. It's a very different approach than traditional CBT. But practitioners these days seem to favor third wave CBT and think it's preferable to traditional CBT for treating tinnitus. We can't prove that's true, but we do know that it's very helpful for people. And so third wave CBT is an option. It's important to be aware of the traditional CBT and third wave CBT, and there are resources available to learn more about these different methods. So third wave CBT, like I said, it's facing your tinnitus head on. It makes the assumption that changing thoughts and beliefs and reducing uncomfortable emotions are unnecessary for improvement. Behavioral change does not focus on being relaxed and comfortable, but living in accordance with our beliefs and values, even in the face of discomfort and hardship. So that's like exposure therapy, facing things head on. Third wave CBT includes mindfulness-based approaches such as mindfulness-based stress reduction and ACT, acceptance and commitment therapy. So that's third wave CBT. Tinnitus retraining therapy, this was developed by Dr. Pavel Jastreboff in the late 1980s. It really became of age in the 1990s. And it caught on around the world, and I would say that TRT is used more than any other method around the world today. It's very popular. Many audiologists and other practitioners have been trained in TRT. You'll have a lot easier time finding a TRT practitioner than you will a CBT practitioner who's competent in tinnitus management. TRT is a combination of counseling and sound therapy. The counseling is very structured, very detailed, sometimes very complex, and it's all based on the neurophysiological model. So that's what this diagram shows at the bottom here. This is a simplified version of the neurophysiological model. This is what Dr. Jastreboff came up with. And just in a nutshell, it says that tinnitus is a signal in the auditory system that's processed as an auditory signal, and we can be aware of that auditory signal. Now, if tinnitus is not bothersome, that's all it is. It's an auditory signal. If tinnitus is bothersome, then the limbic system causes emotional reactions. And these emotional reactions can result in stress reactions, and that's the autonomic nervous system. So you can see that TRT relies on explaining what's going on in the brain when a person has tinnitus, and especially when they have bothersome tinnitus. So the treatment is all about disconnecting the limbic system and disconnecting the autonomic nervous system so that tinnitus becomes just a benign auditory signal. And part of that process is background sound. That's the sound therapy with TRT, which is adjusted to a very specific level. It's a specific type of sound. You listen to it all day long, and that helps to promote habituation. So that's the whole idea behind TRT, is a combination of this counseling based on the neurophysiological model and a very specific form of sound therapy and sound enrichment 24/7, all day long, all night long, having sound in the background, which supposedly promotes habituation. Tinnitus activities treatment was also developed in the 1980s, and this is by Dr. Richard Tyler and his group at the University of Iowa. And it's another combination of counseling and sound therapy. Now, sound therapy is not always used with TAT, but it's usually used, and it's considered partial sound therapy with partial masking, so it's considered optional. And the counseling teaches coping strategies, including activities engagement. So it's a specific type of counseling. It's considered picture-based, that relate to areas of life most affected by the tinnitus. Patients are educated about strategies for improving their sleep and concentration. Patients with hearing loss are taught strategies to improve hearing and communication. Progressive tinnitus management, or PTM, is based on the concept that different people have different levels of need for their tinnitus. Like I've already said, everyone should have their hearing evaluated, and that's this bulk of people who have tinnitus. Some people have bothersome tinnitus requiring treatment, but that's about maybe 20% of the people who actually experience tinnitus. So this uses a stepped care method to treat people only to the degree they need help. And so there's 5 different levels within PTM. Level 1 is basically getting the person to the right person to begin with, and that's usually an audiologist. Level 2 is the evaluation by the audiologist, which determines what the person needs. Do they need treatment for their tinnitus? If so, they move on to level 3, which is counseling to learn skills to self-manage effects of tinnitus. And it's also sound therapy. It's individualized sound therapy, and it's individualized counseling based on cognitive behavioral therapy. Most people have their needs met by level 3. Some people still have a problem with tinnitus after level 3, and they need a comprehensive assessment by both an audiologist and a psychologist. And based on that assessment, level 5 may extend what was done in level 3 or use a completely different form of treatment. So level 5 opens it up to all kinds of possibilities. Level 3 is a counseling protocol and a sound therapy protocol. And then tele-PTM, we can't do the audiology evaluation by telehealth, but we can do the skills education level. We can do the interdisciplinary evaluation, which is level 4, and we can provide certain forms of individualized support. So we've done studies on this. We've got good results. PTM can be administered by telehealth as long as it's levels 3, 4, and 5. But anyone who does tele-PTM should first have their hearing evaluated and determine if they need treatment for their tinnitus. Audiologic management is just a catch-all term. A lot of audiologists just know a lot about these different methods, and they've developed their own counseling protocol. So that's an option, is to just meet with an audiologist who's a specialist. They can answer your questions about tinnitus. They can administer some form of treatment. They can administer hearing aids. They can teach you all about sound therapy. They can do all the testing that's necessary. And they know whether to refer you to another provider for anything that they may not be able to provide for you. So that's more of a generic, there's no proof that this is helpful, but I can assure you that a good audiologist is generally helpful regardless of what method they use, as long as they're providing solid counseling based on the fundamentals that we know about tinnitus, and they provide some form of sound therapy with hearing aids or without hearing aids. Combination of counseling and sound therapy is usually what's done as treatment for tinnitus. These are the two slides I referred to earlier, different methods of treatment for tinnitus. And look at all these different methods. So CBT has been done over the internet. There's a bunch of studies that have shown that can be done. So if you want CBT for tinnitus, you might look on the internet, and there are different methods that have been shown to be helpful. Acceptance and commitment therapy and mindfulness therapy are also available from practitioners, and also these have been done by telehealth, so these are telehealth options. There's other psychotherapies. Psychotherapy is talk therapy. Psychotherapy is basically counseling. There are many tinnitus apps. Some of them are very good. A lot of them focus just on sound therapy, but some of them offer different counseling techniques. That's something to look into, and they're inexpensive or they're free, so you can get a lot of bang for the buck with tinnitus apps. There's biofeedback and neurobiofeedback. There's non-invasive brain stimulation using all these different methods. Probably the most well-known is transcranial magnetic stimulation, RTMS. And that's a method where they put a coil over your head, and they use electromagnetic pulses. This is actually FDA approved for treating depression and I think some other disorders. So it's a recognized therapeutic procedure, and it has been used for tinnitus. So far the results are equivocal, and we just don't have enough research to recommend trying this, but it's generally harmless, and it's something that could be worth trying, but I don't recommend it. I would just say be aware of it and keep an eye on the research that's being done on it. More methods of treatment for tinnitus. Invasive brain stimulation. They've actually zapped different portions of the brain to try to actually change the tinnitus signal, but also to help people feel better about their tinnitus. Bimodal stimulation has a lot of interest these days. One is stimulating the tongue with a tiny electric pulse along with a specific form of sound therapy. There's sound and haptic. So sound therapy plus haptic is tactile stimulation, wearing a device on the wrist that is very sophisticated, that activates different parts of the wrist. That's been used for tinnitus. Sound stimulation during sleep, there's a specific method of stimulating the ears all night long during sleep using the tinnitus-matched sound. There's migraine-based treatment. Migraine is not necessarily a headache. Migraine is all kinds of symptoms that a person can experience even without a headache. And so there's some theories that tinnitus is caused by whatever the mechanism is that causes migraine that may or may not be associated with headaches. And then there's complementary and alternative methods. There's many different methods. People have tried acupuncture, acupressure, different supplements, different ingestible products, homeopathy. There's really no proof that any of these work, but they do help some people. So some people will swear by these methods. Some people will say, I took ginkgo biloba and I feel much better. So I can't tell you yes or no, but I would say be skeptical. And if you want to try anything, make sure it's safe. And don't get taken by scams. There's a lot of scams on the internet. They're going to try to sell you some kind of a product, and there's really no proof that it works. Overall recommendations: learn all you can about tinnitus. Be an informed consumer. And that's what this presentation is all about. I'm trying to inform you so that you can make a wise, informed decision about whatever you do about your tinnitus. There's many books available. I mentioned my books at the beginning of my first session, and there's other books available on the internet, and it's just a matter of finding a good one and learning all you can about tinnitus. You can learn to do a lot to help yourself. So these are self-help techniques. And sound therapy, for example, there's internet-based CBT, there's other internet-based programs, there's apps, there's all kinds of ways you can help yourself with tinnitus. Audiologists are always helpful to answer questions and provide guidance. I've already mentioned that there's good apps available, and you might want to take advantage of those. They're free, they're inexpensive, and they cover sound therapy, CBT, mindfulness, and other different therapies. So I would recommend find a good audiologist you can work with who can help you with sound therapy especially, and also provide counseling. You may be interested in hearing aids. Even if you're a marginal hearing aid candidate, hearing aids can be helpful for tinnitus, especially with the streaming features and the sound generators built in. And make sure that your hearing needs are met and you're not blaming your tinnitus for any hearing difficulties. You might need hearing aids to hear better, and that would reduce your stress and improve your quality of life. If you have sound hypersensitivity concerns, make sure those are addressed. Hyperacusis, misophonia, noise sensitivity, phonophobia. Sign up for a method of tinnitus treatment only if you feel it is needed and you have confidence in the provider. The formal methods require a commitment to attend multiple sessions and possibly to purchase special devices, which are relatively costly. So again, if you're an informed consumer, you will know what these differences are. And I'm a minimalist. I would say always start with what's free or inexpensive and work your way up if you think you need more than that. Now, you may need something right off the bat. You may be in serious trouble and you need help right away, and that's where you need to meet with good providers, possibly a good psychologist and a good audiologist who really understands tinnitus and can help you. So that's it for an overview of treatments for tinnitus. Hopefully this is helpful, and feel free to contact me if I can be of any help answering any questions. So the next session is part 5. Hope to see you there. It's a real short session, and thank you for participating.